Is there such a thing as clinical depression?
So again, there's no evidence that there is a specific subgroup of people with depression who have something that is biological and medical and different from the sort of depression that we might all experience. We've been told for many, many years now, haven't we, that there is, a different thing called clinical depression, which is a proper medical condition. So, most people are signed up to that. If you're told something, enough times, you think it must be true, especially if you're told by experts. But actually, there's no evidence. All these studies on serotonin and depression were done with people with, clinical depression. They'd had depression diagnosed by their doctors, which is all that we really mean by clinical depression. And we're still not finding evidence for, biological abnormalities in them. But also, I think it's important to realise that there's no sort of secret ingredient to the diagnosis of depression. Someone who's feeling unhappy and struggling with life goes to their doctor, says, I'm unhappy and I'm struggling. And the doctor, on the day makes a judgment about whether or not they think they should be treated with antidepressants or not. Should we consider this to be a sort of medical case that we're going to give medical treatment to? And that, that decision, it isn't made by, rigidly following some very precise
there's no antibody in the bloodstream that you can...
No, and there's certainly no objective physical tests that can tell the doctor. And so it depends a lot on the doctor you see, whether they've seen a pharmaceutical industry rep that lunchtime before they saw you, their sort of outlook on life, how they understand emotions, the training they've had, and it depends on how the individual patient presents as well. So some people, come to their doctor convinced that they have a medical problem, that they need, an antidepressant or some sort of chemical solution. And some people come, much more uncertain, not really knowing what the right, what the right way to interpret this is. And that will influence whether the doctor says, you have clinical depression or not as well.
I'm putting myself in the shoes of a GP who's got this patient coming to them. They say they're depressed because, let's say, a bereavement. Their child has died. I feel that I have to do something. I can't send this person away. I can say, oh, you're going to get counselling or some type of CBT on the NHS, but the waiting list is 18 months. It's probably even longer than that. What am I going to do? I'm just going to let this person go? No, I need to be seen to be doing something, because if they do something extreme, then it's going to come back to me. So in order to cover myself and to be seen to be doing something, I'm going to prescribe antidepressants. Isn't that how it would work?
I think it absolutely does work like that. And I think that's one of the main reasons why we have, such huge rates of prescribing. And, yes, understandably, GPs want to feel, want to be able to offer people something. Waits for therapy were very long, or there was no therapy available at all for many decades here. We do now, though, have a national therapy service which has waiting lists of a few weeks, so that's not quite so bad. But I think that's a really good point. I think and I think one of the problems is that because we've medicalized depression, because we've told people to go and see their doctors, then it just gets confirmed, because if you have a hammer, everything looks like a nail, don't you?
Yeah.
And what do doctors have? They have a prescription pad and a diagnostic book. So they tell you, yes, you've got this condition and this is the treatment, this drug.
Absolutely. And to me, one of the great tragedies about when we talk about the depression or any type of mental health condition is because we don't know a lot about it, if we're being honest. Because that does seem to be the central theme of the conversation, is like, look, we don't actually know. So a lot of the time, the treatment or the procedures are actually do more harm than good.
Yeah, absolutely. Absolutely. I mean, this is one of the main messages I would like to get across to people. There is no evidence that you have a chemical imbalance in your brain if you are depressed. So therefore, there's no evidence that antidepressant you're being offered is going to correct that. But we do know that antidepressants are, real drugs that enter the brain and change the normal state of our brain chemistry. And that, and that can have harmful consequences. That's not necessarily a harmless thing to do. We should be worried about messing about with our brain chemistry. And we haven't, because the psychiatric profession and all the psychiatric research establishment has been so focused on this wrong idea that antidepressants target some underlying imbalance or some other sort of underlying dysfunction of the brain. They haven't asked that question about what antidepressants might be doing by just messing about with our normal brain chemistry. What are the consequences if you take these drugs for months and years at a time, as many people do? There's really not very good research on that. There are, as we mentioned earlier, some suggestions coming out that actually these drugs can be very damaging to people's sexual functioning, people's emotional life, that they can cause severe withdrawal symptoms. But all these things have actually come out because people have been reporting them, not because people were doing, had set up systematic research studies to investigate the consequences of use in the first place.
And to me, it derives as well from the fact that if we're being honest, we don't really understand the brain. I mean, you look at the other organs and you go, well, we understand the kidney pretty well, the heart. I mean, the heart is basically a muscle, or the liver, or whatever else. But even if you talk to one of the most eminent neurologists of the day and you ask them a question about the brain, I'm sure a lot of them would go, look, we don't know about X, we don't know about Y, we don't know about Z. So in absence of all this knowledge, we're just thinking of these techniques of how to help people.
Yeah. I mean, I think we've got a wrong impression that we know more about the brain than we do. And that's partly because of the way that a lot of neuroscience findings are presented and reported. So we're always seeing articles, aren't we? Like, you can boost your dopamine by doing this. And, if you have more dopamine, you'll be more active or a better athlete or something like that. And if you lack serotonin, then you're not only just not as happy, but socially dysfunctional or something like that. These headlines get put out there all the time. So people have the impression that we know more about the brain than we do. And I would agree, we don't know very much about it. For example, we've identified a lot of the different chemicals that are active in the brain, but we understand very little about what each of them do.
And why is that?
It's partly because they all interact. So actually isolating the effect of one is difficult. It's also because sticking chemicals into human brains is a very difficult thing to do. So, there's some research done on animals, but not very much research on human beings that directly manipulates brain chemicals for obvious reasons.
Because there's this fascinating, when people talk about mental health, they conflate it with mental illness. So we talk about depression and schizophrenia as if they're under the same umbrella, when, as anybody knows, and I have people in my family who suffer from schizophrenia, it is a very, very different condition to depression.
I think it's a very different condition, but there's not very good evidence for any biological basis for schizophrenia either.
Really?
So it's still a mental illness in the sense that it's an illness or condition that we diagnose or identify on the basis of how people behave.
I guess what Francis is getting at, I think, is more that depression is something that we probably all experience at one point of our lives to a lesser or greater degree. Schizophrenia is a whole different story.
Yeah, which I completely agree with. Yeah, no, absolutely. I mean, I think depression is something understandable and familiar, and schizophrenia is quite a radically different state from our ordinary everyday lives.
YouTube wants you to leave. I don't. Click the next clip. Go on. You know you want to.